Family Mission in Githunguri is the recent flagship hospital to acquire the AfyaPro system. Since the system's installation, there has been significant administrative improvements. Here are some of the ways the software has changed the facility.
When a patient comes in, this is the first office they start. Most patients come in basically because of treatment, so you have to start by briefing them up. What is the main objective? Some of them are sent for lab, some of them are sent to the physiotherapy, some of them they just need treatment. So you have to start by registering the patient, briefing them up on where they are going to start. So they start here, you register, then send them to the triage. From the triage, the consultation. Then from the consultation, depending on maybe the clinical findings, it can be sent to the lab or maybe the pharmacy. We use the 205A, 205B. Those are the standardized MOH registers. We have to document them there, generate an outpatient number, then write a card that is also branded with the hospital's name. Once you write the card, you send them to the triage. After the triaging basically it's just about temperature, weight, blood pressure. Then you can send them to the consult. Before, when you're using the manual one, before you write a card here, register using the 205, 205B, it will take a lot of time. You are going to receive some complaints from the clients. It was very tedious. It has a lot of disadvantages. The system, according to me, the system cannot fail us because now the system keeps on running all through. The moment I register a patient here, using the system, even before the step, 3 steps from here, it's already in the next place they're supposed to go. If it's an external lab request, once I have finished registering here, once I click, it's already in the lab. The lab has already seen there's a patient waiting for a certain test. If the patient has to go to consultation, once I click here, at the triage, they have already seen there's a patient who is coming for triaging. So the system is very fast, but comparing with the manual one, once you document, it's hectic. You have to go take the card to the triage. The triage, then they have to take the card, and maybe there's a queue.
One of the key features of the AfyaPro software is its easy to use and configurable models. These models are tailor-made to cater for the needs of every individual's workstation.
Once the patient amekuwa registered, the patient anakuja hapa, you check from the registration. So you look at the payment, anastahili kulipia whether NHF or cash, and you send the patient to either triage or to the consultation. We used to use the manual one, of which I used to write the receipt. Right now I'm not using the receipt. You just click and you print the receipt.
The system is unique in such a way that it can accept payments for both cash and insurance patients and still enable the cashier to generate detailed billings on all services rendered.
Kutoka ianzishwe, we have seen a bit of improvement since hakuna kushinda ukitoa kadi. Unatoa, okay, previously patient alikuwa anakuja na kadi hapa, so you check the card, umuulize swali, umuulize whether you are paying using NHF or cash. So sahi ni it's a flow, in a flow yani. Juu patient akikuja anakwambia jina peke yake, you just look at the system and everything is okay.
Vitals are a key component when it comes to patient diagnosis. With the use of the system, nurses are able to key in patient vitals, and if a patient requires immediate attention from a doctor, the nurse is able to assign to the required specialist.
In triage, we take vitals, BPs, temperature, weight, and we also prioritize patients. Ndio tuwape kipaumbele waonekane before wengine.
Facility previously used to write down patient information, and as you all know, writing down can be a bit time consuming and tedious. It is now evident with the use of the AfyaPro system that patient flow has been seamless and patients spend less time queuing.
Before tuanze hii system, tulikuwa tunatumia cards. So nilikuwa nikiingia kwa daktari kumpelekea kadi ya patient, nimeona ana need to be prioritized na iekelea juu ya zenye zilikuwa. So sitaweka na mpangilio. So hiyo yenye na prioritize nitaekelea juu. Daktari atajua kwa nini nimeekelea juu. So far nimetumia system for like I can say 24 hours. So sijaielewa vizuri, but I'm hoping for the best.
The transition is okay. First, it is efficient for the patient and also for me, because it is fast. From the triage up to here, it's fast and efficient. You can't compare this with manual. Manual, first, it is tiresome. For me, writing, you write a lot, but for the system, everything is there. So you just maybe click, or the only part you write is the history part. So I can say it is faster and not tiresome like the ones we were using before. The system, it's okay, because everything is from the patient history, diagnosis, lab, it's just well elaborated just there. So I don't think for the waiting time for the patient is long for me. The fact that everything is configured at the same place, from the history, the diagnosis, the lab test, you don't have to click to another part. When you have the history, you can also click at the laboratory and radiology. And also you can use multiple tabs. Like you can send the patient to the lab and at the same time radiology, at the same time drugs.
Before, lazima nigerudi maybe reception, niulize kama mtu akona NHIF, maybe ni mtu mzee. Lazima nirudi hapo kama mtu hajalipa, lazima arudi hapo. But sasa kwa system, akiapia kwa system lazima akuwe amemaliziwa kila kitu. So hakuna haja ya kushinda nikiuliza uko na NHIF ama umelipa. Kama ni NHIF inaonyesha. Hiyo namba yake inaonyesha. Na before I was just taking time to ask the patient the card number. Maybe kama amelipa. Wengine hata wajui NHIF ni, so itabidi tu mimi mwenyewe nijipeleke. But now it's a bit easier.
Drug dispensation has been made more efficient with the use of the AfyaPro system, with long patient queues now being a thing of the past, and also pharmacists are able to restock finished drugs.
Since we started using the system, you can see the flow is okay, because the workload in a limit. Now that don't have to write all the documents, now we are using the system, we think we are doing things faster, yeah? So time, we are not wasting a lot of time, because previously the patients have to queue for a long, so that we can make all the records of the drugs and then dispense, because you have to first record the drugs before you dispense. As for now, we are not wasting a lot of time. The job is not tedious now, yes, so we may simplify the job as much as possible. Yeah, and we are enjoying working now, because previously we were complaining so much. Yeah. Now no complaint. Yeah, okay.
At least iko na accuracy. Ushindi ukienda kuconfirm kama patient amelipa, because you can't compare it with the other one, because the other one everybody could access.
Holy Family Mission in Githunguri is a health facility with multiple workstations. Reports are able to be generated from the AfyaPro software and viewed by a unique user, mostly being the hospital administrator. This has created a form of transparency when it comes to conducting tasks.
We are glad to have a system that can give us a history, because as a hospital, you need to have a history of the patients and even of statistical data because of the future happening. We needed that much, and the indications that the current one is going to give us. So we are happy, at least to begin with this. As an administrator, I'm more keen to know of the results. The results are the ones that are generated in the reports, that so that from my end, I've found that I can know who has come into the hospital, how many have passed through the registration, and I am able to follow whether they went through the doctor, or they consulted a doctor, and even whether they passed through the laboratory, all these details. You know, when you have a system that you can follow and validate, so that there are no shortcuts, there are no things that are happening. A validation that whoever has registered at the front office was also seen by a doctor. It's important. And the same one was also attended in different departments, in the radiology, in the lab, in the laboratory. So we are able to know how much. And also, there is a billing aspect. You know, though a faith-based institution, we are also keen to know, are we losing finances? Because we may be, having people coming in, and it is not translating to the bank account. With the system, it's possible. I suspected in the former system that things would happen and drugs would go out of the way and you don't know. In fact, one of the major problems we used to have is you would find the system was not giving you the accurate data in the stock. Up to an extent, you would find some drugs are in the minors. So you wonder how they went into the minors. How did they get distributed or dispensed? And the stock is indicating there were no stocks. So the system was incomplete in the sense that you would not know when you have run out of stock. And also, there must have been some other drugs that were dispensed and did not pass through the system. But with the current system, we're sure whatever has come in and whatever is dispensed is relating with what is on record in the physical. So with the current one, we can be able to know, what is in stock, so that we can be given a warning in time to order, so that you don't run out of stock, which can be frustrating when drugs are not there. We can be tempted to be sending people to go and buy outside, which is a loss to us. We would want to sell to dispense ourselves, and also we can manage to buy in time before we run out of stock. It creates a good name to the institute when you have good, accurate records running and you are able to buy in time, and also a system that is telling you the expiry date of the drug, so that we don't have to throw drugs away.
AfyaPro software is a web and cloud-based software application. It's built under the Philips Vital Health software platform. And so what the Philips Vital Health software platform does, it helps us with plenty of things. One of them is integrations. For instance, AfyaPro is integrated with NHIF in Tanzania. It's integrated with M-Pesa. So with the Vital Health software platform, Philips Vital Health software platform, it helps us with that. Not only that, but we're able to integrate with tools such as Power BI, so that in case someone needs to have a data dump from AfyaPro, let's say some data needs to be extracted, some anonymized patient data is extracted from AfyaPro and transferred to Power BI, so that more calculations can be done, analysis and statistics for patients' data. We can do that. So architecture-wise, the technology that it's built on, it's the Microsoft technologies, ASP.NET and C#. So one of the features that AfyaPro offers is e-care. So we're able to provide care to a patient at home using the mobile app, right? They can communicate with the doctor or professional or the care team that the patient is linked with through AfyaPro. So the patient is able to use their mobile phone, take their vitals and monitor their blood pressure, monitor their glucose values, also their heart rate, and also they can also do stuff on telemedicine, communicate with the doctor through video conferencing and stuff like that, through appointment scheduling, and also they can also chat, even message chatting. Doctor initiates it, patient responds and stuff like that. So that is all through e-care. But not only that, the software also offers population management. We're able to categorize patients in terms of what our clients need to categorize them with. So we can do that. We also offer code systems. We have a wide range of code systems through the Philips Vital Health software. such as SNOMED CT, we have CPT4, we have LOINC, we have ICD-10, 9, and also 11, the current one. We can do all that with the help of the Philips Vital Health software, but that was built on top of AfyaPro.
Tinganga Catholic Dispensary is one of AfyaPro's success stories in Kenya. The health facility has been using the AfyaPro software for a couple of years now, and here is the experience so far.
Well, in daily basis, we conduct manual tests, and we've got several tests. We do even chemistry. When reporting to the doctors, you don't have to keep on moving up and down. After you're done with the results, you just key in and you send. So it's been simple. Even when doing the reports, it's easier because you just log in into the computers, you just do your thing and that's it. It's the best because even when you're working, they are monitoring. In case of anything, they have people on the ground. So if you have a challenge, it will just take a few hours, just a phone call away, and they work on it.
So far, the system is good. Okay, I'm so grateful for it, by the way. It has made our work to be simple, especially as a clinician. You don't need to following the patient every day. At least when patient come, you can call and retrieve what he has been done for the previous days. Yeah, like the prescription, the history of the patient. Yeah, so you find it's very simple for follow-up. The biggest thing about the software is the recording and the communication between the other departments. It's so simple. You don't need to move from one room to another to tell you, maybe for a clinician to go to a pharmacist to tell him what to give. You just check on the system and you can see what is prescribed.
Kazi yangu ni kuregister patient na kulipisha. Kama ni billing the patient, itanifanyia hiyo calculation. Unlike nikitumia manyo, unaona lazima ni hesabu.
So basically I work in different units that we have. That is the HIV clinics, TB clinics, diabetic hypertensive clinics, outpatient consultations, IMCI and the child immunization services, antenatal care and postnatal care as well. There are also other activities that we do such as cervical cancer screening, which is also available in our facility, and prostate cancer screening as well. Nowadays it's easier to move around the system because of the way it's also been arranged. The layout has been changed, which has been very helpful to get access some of the documents that you require. Anything that is software based is easy to use, especially if you're literate about it and you've been trained about it. So the system itself, working with the system is very easy. Even from the version 2.0, now we are 2.7. Yeah, working with the system has been very easy. The only minor challenge that I have, what we have as a facility, is the network issue, of which we are really trying to engage all the partners that we have. We see if we can get a stronger internet connection. That will be very beneficial in ensuring the system works as convenient as we'd like.
AfyaPro Connected Care, affordable, quality care for all.